So everybody has been showing you H&D images. I'm not going to show you a single H&D image. We're working with radiographs. So maybe that is something that will wake you up before lunch, I guess. So our title of my paper is basically Detection of Dental Caries, Alveolar Bone Recession, and Radicular Radiolucency in Periapical Radiographs through deep learning. And our objective in this work is basically to use AI and deep learning to automatically detect first caries, or what are also typically called dental cavities. So in this region here, we have some dental cavities which are shown in red. In addition to those, we're also looking at gum disease or alveolar recession, which is basically the gap between teeth. So it's shown in blue here. And then the third parameter that we're kind of interested in segmenting is basically radicular radiolucency, also typically referred to as dental abscesses, which are generally around the root of the teeth. These are not H&D images, but they're basically very important to oral pathologists. We're working with oral pathologists, so they're kind of looking at this, and they're interested in using this for their research, and I believe they use it in conjunction with H&D to kind of make various decisions. The social impact of using something like this is, of course, you get prompt and better quantification in a lot of ways. So normally whenever a pathologist actually looks at or a dentist looks at a radiograph, what they actually do is they look at these things and they are basically eyeballing it. So they're not really putting any numbers onto those things. But with an automated approach, you can actually put numbers on these and effectively quantify them and then use them for your research if you're interested later. Now, of course, this could also lead to a proactive approach where if you can detect these things early on, you might ask the patient to kind of take some preventive measures to avoid tooth loss or more expensive procedures. You, of course, can save time and money. The annual spending in England alone by the NHS on dental care is £3.7 billion, and a lot of that actually goes on, filling cavities and these kind of things. So that's a lot of money. You could potentially save that if you have a effective solution. And of course, this is a handy tool for novice dentists or technicians who might not be trained well enough to actually spot these things. So it might actually help as an aid. And of course, we're kind of saving patients from costly, aggressive treatments. A lot of dental work is generally not covered by insurance in most of the world. So, this is something which could help. Our dataset basically consisted of 120 radiographs, which was labeled by pathologists at the Islamic Dental Hospital in Islamabad, Pakistan, for these three classes. We used a unit architecture or a slightly modified version of unit for this particular application. So this is just a diagram of this. We used unit because it's generally known to work well on limited medical imaging applications. It's basically an architecture which is designed specifically for deep learning on medical images. These are some of our results. These are just input images. We've just kind of changed the color to enhance the images, but the original images are basically grayscale. And these are our predicted masks, and these are our this is our ground truth. So you can see in this case, in these cases, we're getting reasonable results. In this case, we do kind of miss out some of this region, which is kind of larger. Here we're kind of getting confusion. So this actually is, I believe, a cavity which is in red here, but it's kind of being predicted as something else here. In addition to this, we're kind of using two metrics to kind of evaluate our results. So on test images, as far as the mean intersection over union is concerned for caries, the value that we get is 0.56. For radiolucency, it's about 0.75, and then for bone loss or gum disease, it's about 0.318, which is, so out of these three, I believe this is the one which we're having a bit of trouble with. But of course, these are preliminary results. We are planning on collecting more data and seeing if we can add more data, can we actually improve these results. And in addition to this, we're also kind of planning to use unsupervised learning because we do have a lot of data, but a lot of it is actually unlabeled. So what we're trying to do is to, have some part or smaller section of the data as labeled and a large portion as unlabeled, and use that to kind of, see if we can improve our performance. So that's it. These are some of the references. Any questions?
Yes. Are there any questions?
Yeah, just a simple observation, really. Most of these images that at least you showed were fairly low contrast, right? If you do a simple, say, contrast stretching or a normalization before, training and testing the unit, do you think that would have some effect, or have you tried something like that?
We haven't tried it yet, but we could definitely look into it. That's a good suggestion. Yeah, thanks. Anything else?
Thank you very much. So, huge advantage you might have over digital pathology is that you can have time series images. Are you considering using that information as well?
So with time series, you're saying like maybe use something like the spatial context, or?
You have images between half a year of the same patients.
Okay. We could. So you're saying if we track patients over time and see if they can. Yeah, I think that's a useful suggestion. We could definitely use it. It depends on our collaborators, but we will definitely forward the suggestion to them. I think that's interesting. Yeah.